Hi everyone. So topic for this talk is sailing into healthcare data science. To talk about me, I'm Vinay Kumar. I work as senior clinical research scientist and my company that I work for is Cytru Inc. It is situated in US and have been working remotely for quite a long time. I also actively organize events for AI ML community, which is one of the largest data community in Bangalore and it's growing. I like to talk about natural language processing, healthcare innovation, and everything you see in this talk. These opinions are solely my own and do not express the views or opinion of my employer. So, before we delve into the healthcare data science and how we can apply data science for any healthcare data, it is important to see the impact it has in terms of the gross domestic product. If we try to estimate healthcare spending, it is dependent on population size, healthcare quality insured per person, price per unit of healthcare. And I have a couple of websites here that you can go to, and you can see that national healthcare expenditure for US grew 4.6% to $3.8 trillion in 2019, which was close to 11,582 per person, and it actually accounted for 17.7% of the GDP. So it is a huge factor in the GDP. If you go to the second website that I have here, you can see that in US, the expenditure in 2019 was 16.8. You can also see for India, it is very less right now, 3.6. There are multiple factors to it, and there is also a lot of quality metrics which is kind of affecting these numbers. So you can actually go to this website and see a lot of statistics if you are interested in to understand how the healthcare spending is in terms of GDP percentage. Let's look at this document. So a patient goes through different journey when they visit a clinic or a hospital or any healthcare setting. This is an example of a 5-month-old boy with cough, and this example I have taken from a website called emptysamples.com. That's the source. Here you can see a document contains the description of the chief complaint, history of present illness, review of the whole system of the patient, if they had any vaccination, birth history, any family history, any social history like smoking, drinking, alcohol, etc., any past medical history, and if they have any allergies and what were the medications. In US, typically they do a lot of physical examination and they document it properly. They can be doing labs, assessment, diagnosis, and they can plan for treatment. I know this data initially when you are not into healthcare, it's not easy to understand. That's where I have tried creating a journey of the patient. Through that, we will revisit this slide again and we'll see how much we are able to understand after the explanation that I provide to you. I will also be walking you through how these different data points or data types relate to AI techniques like computer vision, speech processing, or natural language processing. But before that, let us understand what is a typical patient journey that a patient goes through, and this you can also correlate if you have or visited for yourself or if you have visited for any of your relatives. You will see in a typical hospital setting, a patient when they are sick or if they are injured or if they are healthy. Mostly there are these three scenarios in which they will require medical attention. If they are sick, they can visit a hospital or a clinic. If they're injured, most likely they will be carried to hospital or clinic in ambulance, and they are likely to consult a doctor in the emergency department. If it is injured patient, also if they are sick, they might see a general physician. Once they consult a physician or a specialist, so specifically since I work into US healthcare, I'll be throwing in some pointers in terms of US healthcare, how it happens. Typically, you have a primary physician that you are supposed to visit, and visiting specialist is going to cost a lot. So what happens through a primary physician is they may say you might actually require to visit only three different specialists, maybe a ophthalmologist, maybe another specialty doctor. However, if you decide to go on your own, you might end up visiting six or seven specialists. So the primary physician will be able to boil it down to less number of specialists to visit, hence less cost. So physician or specialist will try to assess patient condition. Typically when somebody visits the hospital, they will take vitals. Now why vitals are called vitals? Because these metrics, heart rate, blood pressure, respiratory rate, SpO2, temperature, height and weight, these measures are indicative enough of the vital organs inside the body. For example, heart rate is indicative of how the heart is performing. SpO2, we have recently in the COVID time, we have seen this metrics, and we have also seen the devices that people are using that basically ionizes the blood and tries to give the SpO2 measure inside the blood. Respiratory rate is more towards the lung. So basically all these vitals are capable of telling how the body vital organs are functioning inside the body. That's why they always take vitals. If anybody has any infection, that might trigger a temperature rise. So that's also a very good indication that the body has certain infection somewhere. And those are the reasons they typically do the vitals, and mostly it is done by nurses. When a patient visits the doctor, the first question a doctor will have is, what are you experiencing? So patient will try to put their problems in their own words, and the most important problem become their chief complaint. They try to describe the problem that they're experiencing in their body, in their mind, and they try to explain it more subjectively, which is when it is called symptom. For example, high temperature is a very subjective measure which is experienced and explained by the patient. However, a doctor cannot take decision based upon the subjective measures. They have to convert that data into objective data. So when the symptoms which is experienced by patient is captured by somebody other than patient, it may be nurse, it may be their relative, it may be the doctor. They measure it and they write it down, they become sign. For example, the same temperature if measured through thermometer rated 99.5 degree Fahrenheit becomes a sign. So let's say somebody says they have chest pain. Now chest pain can occur because there is problem in lungs, there is problem in heart, there is problem in stomach. Maybe the person is experiencing gaseous situation inside the stomach and they may experience chest pain. So based upon that, a doctor will make up their mind and they will have a mental picture of what is the possibility of one problem versus another. And that's when it's called differential diagnosis. Now, they need more objective data to be able to diagnose a particular disease. And unless the diagnosis happens, unless they reach to a conclusion that the person has this problem, which they like to call diagnosis, they will not be treating any patient. So diagnosis has to be very well established before any treatment is done to any patient. Now, out of these differential diagnosis, like for example, I gave chest pain, they want to know if there is any other objective data that they can obtain to reach to a conclusion and reach to one or two diagnoses. So here they might like to order labs. For example, they might collect blood, urine, swabs. They may do some imaging like X-ray, CT scan or MRI. They may do some culture. So basically, like we have agriculture, we grow crops in agriculture. Same way in culture, a blood sample or a pus sample, which is a dead white blood cell, is collected and they are grown in a glass plate in a lab, and that's the process of culture, in which they will grow the microorganism in the lab and they will put the antibiotic of different power and they will try to see with different dosage strength which dosage strength and which antibiotic was able to kill the microorganism which was grown at the body temperature in the lab. If that antibiotic was able to kill the microorganism, then it's likely that that will also kill the microorganism which is present inside the subject or the patient if they are injected or they are given that dosage. Over time, what happens, our body get resistant for certain antibiotic or certain drugs. So that kind of information is also obtained through culture, because they will give you a sensitivity report which will be talking about resistant, intermediate, or sensitivity of susceptibility of different drugs against the microorganism that has grown inside the body of the patient. So based upon the required information, now doctor will try to make diagnosis or set of diagnosis. Once they reach to that diagnosis using more objective data that they may require, they will have a treatment plan. The treatment might be giving drugs, therapy, it might be some surgery. If a patient has high sugar level because of which certain problems are happening, for example, recurrent infection or any other problems, then they may suggest lifestyle changes for any pre-diabetic patient. Once a patient visits a hospital, they might receive the temporary treatment at the emergency department, and you would have noticed anytime you go to a hospital you have to report to OPD, that is the outpatient. Once the diagnosis is requiring the patient to be admitted, they will be basically assigned a bed inside the hospital, and they will become an inpatient. So after treatment they will get discharged. Now, a lot of time people ask me when I present this, why healthy patient will go to hospital. So healthy patient can go there for preventive health care, like they will like to do regularly check their labs, the bloods, and they would like to make sure that all the organs are functioning properly. So at a very non-medical level, I would say all these body organs, if they are functioning properly, they are supposed to release hormones and chemicals in the blood. And looking at the concentration of that inside the blood, the indication can be there that if the concentration goes below or above the range, that means one of the organ is either releasing excess chemical or it is not releasing enough chemical in the blood. And that's how these lab reports are able to tell us or give us the indication that which body organ is exactly not functioning the way it should. To give overall idea of healthcare system, we have majorly these players. We have payers, who are the patient or the insurance companies, the provider who provide the medical facilities like physician, nursing homes, home health, and the producers. So here basically we can see all these players. So you can read more about these. This is the source, and in case you have interest in these domains, you can always reach out to me. But for the sake of this presentation, I'll be skipping this through. So here basically you can see that a patient, when they are sick, injured, or healthy, they will visit the provider, and initially they used to give compensation directly to the provider. In return, they used to get the healthcare. But then there was a problem of risk. So let's say one patient gets sick and they are exhausted because of they exhaust all the money on receiving their treatment. So as a solution, back then 1940s 50s, people started pooling the risk, which means in a society everybody will contribute to the fund. Right now you can call it insurance premium. So that's what insurance companies are doing. They will share the risk among many members of the group. They'll collect the fund. When one person gets sick, they'll get the money from the fund. So overall risk on one person goes down. And now the model looks something like this. A patient receives healthcare. They give the compensation to provider, and these compensation can be part payment, out of pocket payment, and they basically on regular basis give premium or taxes to the government or the insurance company. And when the patient gets sick, they get the healthcare from provider, and they don't have to pay the complete money. Majority of the amount will be paid either by government. In US it is Medicare and Medicaid, TRICARE, all these kind of schemes under which they pay the providers, or also insurance companies will be paying these. These I have taken from Stanford courses, so that's the source. And here if you see this US healthcare value chain, you will see once the patient has received the treatment, an insurance claim will be created. Those are reports where we can apply NLP technique. So this is the complete picture of healthcare provider value chain. Here we have the patient who visits a physician. They either become outpatient or they get hospitalized. Then they receive the treatment. While receiving the treatment, they may get support from pharmaceuticals, medical equipment, biotech. They have distributors who will be giving it to the hospitals, and through that it will be finally delivered to the patient on the requirement basis. And they may be covered by different payers and the employers. So this is the overall value chain, how it looks like. The source for this is mentioned here if you would like to read more. So we saw this typical journey where the patient got sick or injured. Now coming to healthcare, and specifically healthcare data science. It was very important to cover these because now I can talk about this journey and how these documents are getting generated. So you can see when the ambulance is reaching to the hospital, they will admit they will admit the patient in the emergency department, and they will document the process, what was done, what they observed in a note or a report or a document or a medical document, which is called emergency note. Once consultation is done, they will generate something called consultation note. If a surgery is done, they will generate surgery note. During the inpatient admission, they will generate admission note where they will have details of the patient. Nurse take care of the patient over the period of time the patient is inside, and typically nurses will be working on shift. Also sometimes physician also will take leave during, let's say, one patient is admitted for next 5 days. It is not necessary the same consultant or the same doctor will stay there. They might go on leave. So documenting these are very important, and this is called clinical document. So like this, in each process, I'm just highlighting few of them. Each process, each lab is generating a report, each culture is generating a culture report as well as sensitivity report. Imaging MRI is generating some kind of report. So if we see imaging X-ray report, we can apply computer vision to understand For example, recently Google has applied it on retinopathy. A lot of people are applying on X-ray, on brain images. Typically, when these reports comes in PDF, we have the problem of OCR. Computer vision can be applied there. When they make this kind of note, those are called medical transcription. So while what happens in a hospital setting is once this consultation is done, somebody called medical transcriber will either type it or they have to write the report. When they want to say it aloud and get it typed, like how we have it in Microsoft Word right now or any speech processing software, that is where all the research for speech processing can come and play their role in healthcare. Once you have medical reports, you can generate insights from those, and that's where you apply natural language processing. So basically, in AI domain, you have either text or image or audio signal or a combination of audio and image, which is the video signal. Accordingly, you get to apply either NLP or computer vision or speech processing. And definitely you have a lot of IoT signals in the world, so different sensor based signal. So that's about the healthcare data science and how healthcare can be contributing to the complete set of documentation and documents and all the information that is getting created in the patient journey. Now, let us go back to this document. You can see this is a running text, this is not a database. So which means we have to apply NLP if we want to extract insights. So from this document, we can extract insights like what is the active problem, what is the chief complaint, what is the allergy of the patient if they have any, what are the active medications, what are the condition of different body organs. So all sort of insights can be generated by applying NLP, which can be rule based, which can be simple machine learning model, but definitely we have to apply NLP for doing the pre-processing, feature engineering, and then we apply the machine learning model. When you have a lot of these documents and document type, then you apply the medical document type identification. That's a document type identification problem. So I hope after understanding the journey, you are able to understand why all those labs were ordered when you visited the hospital last time. So my overall idea was to give you or to reflect upon those common sense knowledge which I gained after working in this area for last I think close to 5 years, and to also help you understand when you visit a hospital what kind of documents are getting generated and where you can apply data science. So as I said, these are the different examples of the kind of document that is generated. So you can head over to emptysamples.com and you will see that these are the document types available and these are the number of document available on this website. And actually there is an interesting problem of medical transcription wherein you have to do a coding medical specialty from the transcriptions. So those transcriptions are available inside empty sample, and Kaggle has this CSV under this problem wherein all these have been scraped and they have been put in the Kaggle. So I hope this overall idea is clear. What is the patient journey in each step, what kind of documents can be generated, and how data science can be applied, or different wings of the data science can be applied to different set of documents or the different set of output that is getting generated in the process. One of the important thing in healthcare or healthcare AI is understanding of the terminologies. Why they are important? You can see this paper. It says surgeon misunderstood pathologist report 30% of the time. So it happens that in the healthcare setting, as I said, there is set of nurses, there are consultant, there are specialists who keep referring a patient from one to another. They will keep sending the patient to labs to get the reports. So there is a huge communication requirement. Also, wherever there is a communication requirement, there can be huge misunderstanding between different pathologists and surgeons and patients and doctors. So basically, to avoid these misunderstanding, Everybody in the system has to speak one language, one terminology, and that's where you will need terminology. Examples I can give: ICD-9, ICD-10, SNOMED, and there are a lot. So you can Google, you'll find a lot of terminologies which has different utility that you can make use of. And it's a kind of ontology that you need to make use when you are doing any NLP on healthcare data. So these are some of the unique academies or unique. If anybody want to learn about healthcare, they want to dive deeper into healthcare, understand the data. So understanding the data in the data science is very important. Once you have the domain knowledge, you have an extra edge. Understanding that take a lot of effort because most of us in data science come from engineering background. However, this is completely the mm, like how we call it in India is a complete medical background. So I have been trying to learn as many as I can into the healthcare domain, and these are again, I'm not endorsing them out of any sponsorship. These I find them personally interesting. It's up to you. You might like to explore it, and I'm not endorsing any of them or advertising for any of them. So I wanted to make that point very clear. So this is one academy. Here you can see you have medical laboratory technology, medical record technology. That is where you learn how to create these medical records throughout the patient journey. Likewise, you have different domains. So you might like to just head over to this website and might like to read about these. You want to learn about healthcare anatomy and different body parts. Khan Academy is one of the best resource that I like to go to. Apollo also has a very great learning platform. This is the platform. And there are a lot of healthcare courses on edX that you can go to. Coursera also has very good information and courses on healthcare. And Udemy also has a lot of courses. So you can look for those. A lot of US healthcare data come for medical billing and coding. And this is very important aspect of medical documentation. Whenever a patient visit a hospital, the claim goes to an insurance company. They have to evaluate the claim and they have to entertain the claim. They have to do the claim reimbursement, and in the process, the hospitals are not supposed to only send the document, they are supposed to convert those documents into medical coding using one of the terminologies like CPT, ICD-10, or HCPCS, or many more. So medical coding is basically converting those transcriptions into identifying the important resource utilization from those documents, highlighting it, and accordingly, as per the resource utilization, putting a billing amount, and then summarizing it and sending it in form of claim to an insurance company. So if you want to learn more about medical billing and coding, what it is, this is the website that you can head over to. Obviously, when you search healthcare courses on Google, you'll get a lot more details about what are the courses possible on healthcare. So I definitely cannot go and exhaust all those for the sake of for taking care of the time here. So if you have any questions, feel free to reach out to me on this email ID. So thanks a lot, and you can always connect with me on LinkedIn. I provided the details here, and thanks a lot, Hosha, for this event and for inviting me to speak. Thanks a lot to the community, the GTG Mysuru, and the TensorFlow user group Mysuru. Thanks. Bye.